Hi guys, how are you? It's Dr. Pam, owner and founder of Academic Coaching for World Changers. And yes, I'm still in Mexico City, but we have boot camps coming up, and I just want to remind you why you might need a boot camp. One of the things that makes us so really good, and by the way, we are the very best at what we do, is we really listen to our clients. And what I've heard for the past couple of months is there's lots of questions on reality therapy. So if you're signing up for our NCE boot camp, which is coming up on the 6th of March, or the weekend after is our 5-letter boot camp, either one that you're signing up for, you need to know reality therapy. So let me tell you about it. So it is by Glasser. It is called postmodern. That just means it's pretty new. I'm pretty sure he's still alive. Marsha Linehan is also still alive, but most people are dead and they haven't written any theories. So Glasser says, suck it up, girl. You did it. You own it. He said it didn't matter why you did it. I don't care what happened when you were a kid. I don't care what happened when you were 4, 5, 6. There's no transference. There's no unconscious. You did it. You own it. So one of the things you'll see about Glasser is he's got those 5 basic needs. And when I say that, people always go back to Maslow. No. These are his 5 basic needs. He said we need survival, love and belonging, power, freedom, fun. He said love and belonging is the most important. Okay? So the assumption is people already have food. So love and belonging is what we all seek according to him. So if I decide I'm going to get love and belonging from somebody else's husband, that ain't my husband, if I do it and I get caught, if I do it and I hurt somebody, if I do it and I lose my friends, I need to accept responsibility. I did the action. I've got to take ownership for that. I can't say, but when I was 3, my mother wasn't there, and I didn't have that constant relationship. No, he doesn't buy any of that. There's no unconscious stuff. Suck it up, Pam. You did it. That's really his theory. So he's very postmodern. He's new. He talks about choice theory. Remember, also existentialism is a choice theory as well. So what makes this one different, talks about responsibility. You own it. Remember, this one also has the WDEP. It's by Balding. But you might get a question that says something as easy as what 4 letters would go, what's the acronym that someone using reality therapy might use? WDEP. However, remember, that is not, they're usually a lot more than that, not just recalling the basics. So let me give you a couple of questions, or at least 1 or 2, to show you what it looks like. Remember that reality therapy, Glasser, is present focus. We don't dwell on any past trauma. We ain't trying to bring anything from the unconscious. Don't blame the environment. No transference. And he did not diagnose either. Okay, it's really about taking ownership for your behavior. And if we really look at many of our past theories, there was always a reason why you behaved that way. He said, no, you did it, you own it. So let's look what it looks like in a question, okay? So, a client reports feeling depressed because no one respects me at work. The counselor asks, what are you doing when you feel disrespected? Okay, what do you feel when you're feeling disrespected? Those are in quotation marks. So the client says, hey, I'm feeling depressed because no one respects me at work. Okay, what are you doing? It's not feminist therapy that says what's the environment doing, it's what are you doing? Those are my hints in the question. My 4 choices are A, cognitive restructuring, B, externalization, C, focus on total behavior, or D, transference interpretation. If you want to take your time and stop the video and come back and watch it, that's great. Okay, but remember, we're always going to rule out, even if you know the answer, I need you to touch all 4 answers. Cognitive restructuring is CBT, right? Beck said you got some stinking thinking. B, externalization, that's a key word, lets me know that's narrative therapy. I took this story out of my head, and sometimes I rename the story. It leaves me with a C and D, focus on total behavior, or D, transference interpretation. And I think I just mentioned to you a minute ago, he did not do transference. So my best answer, of course, is focus on total behavior. That's part of the WDEP. What is the client doing? That's what we're looking for in a question. They give you hints and clues in the questions. It's a reading test. Did I mention that to you? So many of our clients spend so much time in the four choices, but you didn't even understand what the question is asking you. So stay in the question. Understand the question before you look at any of the answers. One more, guys. Which of the following is most central to change in reality therapy? Change. I want to make change. The client needs to get better. And what would reality therapy, what would Glasser focus on? That's what the question is asking me. We're going to paraphrase, put it in your own words. So let's look at our four choices. 1, insight into childhood conflicts. B, emotional catharsis. C, self-evaluation. And D, therapist interpretation. And remember, I don't care if you get it right. I care that you understand why you got it right. We're going to rule out always. The first one said insight into childhood conflicts. Oh, red flags. Insight is Freud. Almost always it's Freud. He's helping you look why you behave that way. And especially childhood conflicts because you don't remember them. Emotional catharsis. Catharsis is that emotional release. The cry, the moan, the sigh. You'll see that it's a Freudian term, but y'all use it as one of his curative factors. Remember that. I'm now down to C or D, self-evaluation or therapist interpretation. I told you already, he didn't interpret. So the self-evaluation is the WDEP, the E is the evaluation. It's really that simple. Why most of my clients really struggle is because they've taken practice questions 1,000 times, but they really don't understand the content behind the question. We can help you with that. Sign up for our NCE bootcamp or our or our 5-letter bootcamp, NCHMCE, both of those, March 3rd, and the other one's weekend after that. We really focus on teaching you how to answer questions. We will never make you a better clinician. That's not our job. Our job is to make you a better test taker. I hope I see you in a live session soon. Be sure you subscribe to all of our videos. I release them all the time. If you're following me on TikTok, I really appreciate it, and I will see you soon. Bye, guys.